Hello everyone and welcome to day 2 of week 3. So if you remember from the day 1 video, I said that we would be discussing chapters 5 and chapter 6 this week. In the day 1 video, I did go over and discuss chapter 6, which was related to the office environment and safety. So today we're going to be focusing on chapter 5. Now, chapter 5 is dealing with communication, both verbal and nonverbal. So communication is really necessary, and it's a necessary requirement for everyday life. I can guarantee there is not one day that goes by that we don't communicate with others in some form. In the medical field, the ability to communicate is essential for success. Everything from calling in a prescription to be refilled to documenting in a patient's chart their complaints and their reason for the visit. We have communication all day long. The concern that we have for patients will show in our words, our actions, our gestures, and our tone of voice. We have to be able to communicate in a wide variety with a wide variety of people within the field. That could be anyone from patients to physicians, vendors, co-workers, the family members of that accompany patients to their visits, all different types of people we are going to be able to communicate with. And there are many different channels in which we communicate. We can communicate with people face-to-face, over the phone, in letters and written words. It could be through a fax or in an email. But it doesn't just end there. Good communication skills need to have good interpersonal skills. And what I mean by that is we have to have self-awareness and an understanding of different learning styles. When I talk about self-awareness, I mean you need to be able to know your character, your values, your attitude. Understanding the different learning styles means that you need to know that there is auditory, or people who do by hearing. Visual, people who learn by seeing or physically doing. Or kinesthetic, which is what I am. They have to learn it by touching and feeling and doing. They have to be able to see it, feel it, and follow through with it in order to learn it. Now, when we talk about communication styles, there's actually two different ways. There's verbal and nonverbal. Verbal communication is the spoken words, sounds, and tone of voice that we use. When you are a medical assistant and you're speaking to a patient, you want to speak loud enough that they can hear you, but not loudly, so loud that you're yelling at them or you're breaching their confidentiality. This can be especially difficult with patients who are elderly or who have hearing loss. So when we're talking with patients, we need to be cautious of the words that we use. We need to choose words carefully so that we're not taken to be rude or impatient. You don't want to use technical terms with a patient or medical jargon with them. Not all patients understand that terminology, so you want to keep it as even keel as you can. You want to take into consideration the different education levels of your patients. Not all of them will have high school diplomas or college degrees. You may have to speak to them and change how you're speaking to them based off of their education level. And regardless of when you're talking to a patient, when you are speaking with them and you're using verbal communication, you always need to have a positive attitude. Be empathetic, not sympathetic. You can empathize with them, but don't get sad and sympathetic with them. Being able to be empathetic means that you understand what the patient is experiencing, but you don't physically experience that with them. On the opposite side of that, nonverbal communication involves all the facial expressions, gestures, body language, and eye contact that we use. It also includes the way that we're groomed and our mannerisms when we're communicating. If you're anything like me, I'm a type of person who talks with my hands. So that can be seen as a nonverbal communication as well. It's important to know that the nonverbal and the verbal communication must match, otherwise the patient's going to get a mixed message. If what you're saying sounds positive, but your body is closed off and your arms are folded and your body's turned away from the patient, they're getting a very negative body language and a negative nonverbal communication. So the two don't match and they're going to get a mixed message. Another thing that we want to talk about with our patients and think about is any barriers to communications. Anything that's going to block the line of us having a good communication with our patients. Things such as defensive or angry behaviors. If patients are angry when they come in, there's no communicating with them. Same thing if we have a negative or a defensive behavior, the patients aren't going to get a good sense of the communication. You don't want to use medical jargon. Again, using the big medical terms is really hard for patients to understand, especially if they don't have any knowledge of the medical use of the word to begin with. Try to keep your conversations with them as normal as possible. You don't want to use as many medical terms if you can avoid them. Cultural issues, maybe it's different languages, different viewpoints, people who have stereotypes or biases or prejudice, different religions. As you can see in the bottom picture here, maybe a handshake isn't the way to address a patient. Maybe they view bowing as a way to greet one another instead of the handshake. I know some cultures that having a female doctor is frowned upon, or having a female work with a male is frowned upon because in their language and in their religion, that's not what women do. And the last topic I really want to discuss with you when we're communicating is dealing with patients with special circumstances. Those could be angry patients, patients who are anxious, those who have a hearing or visually impaired, maybe patients who are mentally or emotionally impaired, those who have maybe don't speak English, and those that are physically impaired. So the first four that I'm going to talk about are angry patients. So these are our most difficult patients to deal with, obviously because when somebody's angry, it's hard to communicate with them. For you as a medical assistant, the best thing that you can do is try to remain calm and use positive communication. If you get aggressive or you get angry and match their level of anger, angry on angry does not bode well. Now, the patient may get more angry with your positive attitude, but the more calm and relaxed you are, they will feed off of your energy and it will bring them down. When you have a patient who is anxious, try to speak calmly and reassure them. Let them know that everything will be fine. Maybe do a slight touch on their hand respectfully, or maybe their elbow respectfully. Smile at them. Be empathetic. I know when I have patients who are nervous or anxious about having their blood drawn, I tell them that I know exactly how they feel. I feel the same way. But I try to reassure them that I know what I'm doing, and I'm really good at my job, and they're going to be okay. If you have patients who are hearing impaired, so many of these people will use sign language to communicate, or they might have an interpreter. If they do have an interpreter, remember to still speak to the patient. Don't speak just solely to the interpreter. It's important to never shout at your patient. Sometimes it's easier if you speak slowly and clearly. And face your patient. I know I have a hard time hearing out of my right ear, so I typically will lean more towards my left. But if someone is looking directly at me, it's easier for me to understand them than it is if they're turned away from me. And if all else fails, have a pen and paper with you so patients can write things down and you can speak that way. Those that are visually impaired, always announce your presence to them, especially if they are blind. That way you don't startle them. Offer to be their guide and get them back to the patient room by being their guide. Again, face the patient and speak clearly. Just because they can't see you doesn't mean that you can turn away from them and not face them. And when you're speaking to them, you have to speak, and explain all procedures in great detail. And never try to leave the patient alone for any length of time because they can't see what's in front of them, so it may be a little harder for them. So if you can, try not to leave them alone for too long. Our mentally or emotionally impaired patients, it's really important to determine what level the patient does communicate at, and go from there. Try to have an understanding with that. But typically, if they're mentally or emotionally impaired, they may have a caregiver with them, and the caregiver may be able to give you some tips on that. Always speak slowly, calmly, and keep your messages short with this type of patient. If the patient becomes agitated or anxious, try to help the caregiver calm them down, or the caregiver may do it themselves. But just remember, again, just because they have a caregiver doesn't mean that you speak solely to the caregiver. Speak to the patient. That's what you're there for. Our non-English speaking patients can come with a great deal of difficulty, but it is something you'll deal with regularly on a regular basis. Still treat your patient like a patient. Smile at them. Determine if they understand any English at all, and if not, you want to use an interpreter that is provided by your facility. You can use pictures or pantomime with them to demonstrate as well. And physically challenged patients could be anything from a cane or a walker to a wheelchair. Be patient with these kind of patients and don't rush them. If you rush them, it shows them that you're impatient and they get very frustrated by that. Treat them with the respect and the dignity that they deserve. And if needed, help them to ambulate unless they can do it on their own. If the patient can do it on their own, don't force your help on them. Again, it will make them very angry. All right, guys, this is where I'm going to stop for the day 2 video. Please make sure, again, that you read your chapters in full. As always, I will print off all materials that you need for this day, so you don't need to print anything. And I look forward to seeing all of you on day 2. Have a great day, guys. Bye-bye.